Sit at the table.
Go up now?
All right, we're back live. This is Senate Health and Welfare. And we have with us folks from the People's Health and Wellness Clinic, Vermont's free and referral clinics. And we're going to introduce ourselves first to you, and then we'll ask you to introduce yourselves for the record. You can hear what you have to say.
Okay. I'm Senator Larry Hart from Orange County.
Sam Douglas from Memphis County.
Jenny Lyons, Chittenden Southeast.
Martine LaRoque-Ulick from Chittenden Central.
In Cummings, Washington, People Health Wellness Short. You're here. It's day one. So welcome, and why don't you introduce yourselves for the record and then give us your overview of who you are and what you do. That would be really helpful.
I'm Olivia Sharrow. I'm the Executive Director of Vermont's Free and Referral Clinics.
Dan Barlow, Executive Director of People's Health and Wellness Clinic in Barrie.
So first thing is, what's the difference?
VFRC is the state association that represents the 8 free and referral clinics throughout Vermont, and we are one of the members, and I'm currently the board chair of VFRC as well.
Terrific.
Yes. Take it away.
Yeah.
And we have some information from you online, so we can look at
Great.
that. Yeah.
Great. So I'm Olivia Sharrow, the Executive Director of Vermont's Free and Referral Clinics. VFRC is a statewide association that serves 8 free healthcare clinics. Those are our members across Vermont. All services provided at these clinics are free, no insurance, no sliding fee scales, no payment plans or bills, and this makes us unique in Vermont's healthcare system. Our members provide a range of services, including but not limited to free dental, medical and healthcare, physical therapy, free prescriptions, health insurance navigation, and other services attempting to address social determinants of health. Our members are also deeply embedded in their communities and serve as connectors between patients and other organizations, social service organizations, state agencies, and healthcare providers. And the vast majority of the clinical care is provided by volunteers, which is one of the things that allows us to keep our services free. In 2024, our network cared for 12,854 patients. About a quarter of those patients are uninsured, and those patients represent 16% of Vermont's total uninsured patients. 45% of our patients were underinsured. Both of these numbers, uninsured and underinsured, have been rising, particularly in the last 2 years. 20% of our patients did not have primary care providers. 41 were at or below 200% of the federal poverty level, so very low income, and 10% of our patients are best served in languages other than English. As you can see, we work with patients who face significant and often intersecting barriers in access to care. We have patients who are unhoused, who are undocumented, who have stigmatized employment or gender identities. We serve patients who don't speak English, patients who use illegal substances, who have been labeled non-compliant, and as you saw, who have very low incomes. Our primary funding source is a legislative appropriation. It's a little over 1.5 million. It's managed by the Department of Health, and this funding accounts for just over 50% of our collective operating expenses. So that's all 8 clinics and also the state association, the FRC.
8 clinics.
Yes. And you remembered that we've come in the past, we had 9 until the beginning of this fiscal year when UVM's Health Assistance Program left as a member. For fiscal year 26, we're seeking level funding. In fiscal year 24, we received a very generous increase, and that continued into fiscal year 25. I cannot overstate the positive impact that increase had. Dan will talk about this as well. Generally, it allowed for investment in staff and infrastructure, including 2 clinics that were able to move to larger spaces in safer parts of town on public transportation, which I'm sure you can imagine is a very big deal. It also allowed for expanded clinical care, including oral health services, increased mobile services, homeless healthcare outreach in multiple locations, and that's among others. This funding allows us to keep our doors open, and it also allows us to remain the only place where patients can come where they are guaranteed not to receive a bill. We're a cost saver. Many of our patients, no primary care provider, no insurance, no dentist, would have nowhere else to go besides the emergency room if it wasn't for us. In 2024, our dental and medical services led to an estimated savings of $5 million in avoided emergency room and hospitalization charges. It can be easy to focus on the positive things that we're doing. However, we exist and have seen an increased demand, especially in the last 5 years, because of some pretty significant issues in the wider healthcare system. We are very concerned about, I'll say, skyrocketing prices and their impact on commercial insurance premiums. People come to our network because they can't pay to go anywhere else. In 2024, 1/3 of our patients arrived having delayed care due to cost. 1/3. Anything you can do, including the bill to relieve medical debt, which is great, or supporting other efforts to address rising hospital prices, will have a significant and very positive impact on the work. Access to primary care, as I'm sure you all know and have probably even heard today, is worsening. From 2023 to now, we've seen a 17% increase in patients coming to us who have no primary care provider. Our patients need better access to oral health. We do what we can, but we know that it is a drop in the bucket, and we're often working with people who are essentially at their wits' end. One of our members has had patients come to their clinic having attempted to pull out their own teeth. It's not an exaggeration. The need is extreme, and that's even with some of the recent and again positive changes to Medicaid's dental coverage reimbursement. We're also concerned about housing. As I said, many of our clinics are working directly with unhoused patients, so we're seeing every day the impacts that lack of housing have on their health. We also have concerns about federal policy changes as they relate to Medicaid funding, Affordable Care Act. Again, I'm sure I'm not telling you anything you don't know. Enhanced subsidies, gender affirming care, and access to reproductive services. We are also very concerned about our immigrant patients' health and safety and our ability to continue to provide care that they need. I don't want to leave you on a negative note exactly. I would say this small but mighty network absolutely deserves to be celebrated, but many of our patients are on the margins and are disproportionately impacted by the issues that I've raised. So in this environment, we see our work and therefore, of course, our funding as all the more important. And so we hope you keep that in mind as we're thinking about solutions to these many interrelated issues. Thank you.
Next question.
Sure.
Thank you. What are you considered an FQHC?
No, that's a great question. The Federally Qualified Health Center is a sort of special federal government designation, and we are separate. So we are not regulated in the same way. We actually can't bill insurance, both to be members of the FRC, it's written into our bylaws, but also to maintain the medical malpractice insurance that the clinics get through the federal government to be it's a different designation from an FQHC or a free clinic, and so you can't bill insurance. So that's, I mean, there are other differences too, but I would say that's the main.
Yeah. And I would say at People's Health and Wellness Clinic, we have a small staff. It's 5 employees, but really 3 full-time jobs among us. But as Olivia said, a lot of the care is provided by volunteer doctors and nurses. Some will come in once a month, maybe once a week to see patients. So in investment in the free clinics, we leverage these volunteer hours as well. So we're this special investment, unlike the FQHC, which has, a completely paid staff and a sliding scale for patients. Again, everything we do is 100% free to the patient. We can't bill, Medicaid. We can't bill an insurance company. Yeah.
And many of our members work closely. Many are in communities where there's also an FQHC, and so they work closely with their FQHC partners. And VFRC is a member of the Bi-State Primary Care Association. So Mary Kate Molman, I'm sure, has been around, probably testifying, and she. When talking about their work, there's sort of the FQHC work, and then she often sort of gives us a shout out. But understanding that we're a separate.
Thank you for delineating like that.
Yeah.
That was helpful.
It's a common question.
The common
Right.
question. That's a good one.
Thanks.
Senator Douglas has a question.
Thank you, Madam Chair. Are there, you might know this, if there are any, volunteer tax credits available for those doctors and nurses that's coming and volunteering for your clinic? Those tend to be great ways to encourage volunteerism and also, give them something for donating their time.
Yeah, that's a great.
I'm not familiar at all, but I may have known, I'm gonna look into
Yeah.
that, so.
Yeah.
Yeah.
Please.
So I'll tell you all a little bit about People's Health and Wellness Clinic. We've been around for 31 years as an organization. We're a 501c3 nonprofit. We're located right in downtown Barrie. Moved into a new building 3 years ago. We been flooded out at our old location at Barrie twice, so. Was that?
Why that?
Yeah. So as I said, we're a small staff, 5 employees, really 3 full-time jobs among all of us. Our annual budget's about $440,000. About 45% of that is the legislative appropriation. The rest is, corporate grants, fundraising, et cetera, municipal donations as well. Last year, we served 658 people here in central Vermont. Our coverage area is really Washington County, plus a couple towns in Orange County as well. And we had 229 patients who were brand new to the clinic last year. That constitutes about 545 medical appointments and 440 dental appointments. We have a dental hygienist on staff who's seeing patients 3 days a week. One of the things that we could do last year that the legislative appropriation helped with was expand our oral health care program. As Olivia said, we often hear from patients that they are taking out a pair of pliers and pulling their own teeth because they don't have access to oral health. So last year we found a retired dental surgeon, Dr. Noble, and he volunteers about 3 times a month. And the legislative appropriation allowed me to expand the hours for our dental hygienist and purchase the equipment we needed to do extractions. So we have pulled teeth for more than 100 people in 2024. We're going to continue that work this year. And again, for a lot of our patients, they had no other place to go for these extractions. Even a couple $100 for an extraction is a real barrier for many of our patients. Additionally, we also do health insurance navigations. 85 people were signed up for health insurance through our clinic last year. What we're seeing with our patients increasingly, as Olivia said, is the challenge with the underinsured. Prior to the Affordable Care Act, about 90% of the patients at People's Clinic were uninsured completely. Today, about half our patients are on Medicaid or a private insurance plan, and they either can't find a primary care doctor or they can't afford the out-of-pocket costs. They are coming to us for the care, which is a challenge for our organizations. Again, we cannot fill Medicaid for the Medicaid patients that we see. Additionally, other things that we have done in the past year, many of our patients are unhoused or housing insecure and have substance use problems. So one of our tenants in the building is Vermont Cares, a nonprofit that does needle exchanges. So they do needle exchanges 3 days a week at our clinic. And last year we launched a xylazine wound clinic. I'm not sure if this committee is familiar with xylazine, unfortunately.
I think most of us are. Maybe just share with folks.
It's an animal tranquilizer that's being cut into street drugs now. It causes circulatory problems. So as long as you keep on using the drugs, you develop sores on your body that will not heal. So we had nurses and doctors specifically trained in how to deal with xylazine wounds. Literally helping patients, saving patients from losing limbs. This is how bad some of the problems are out there. We've also developed xylazine wound care kits that we send the patients off with, so they can treat their own wounds out there when they're not at the clinic. Additionally, this was not part of the legislative appropriation, but we worked with United Way, got a small grant, and had several volunteers and staffers trained in LGBTQ plus appropriate care. And twice a month, we have a clinic just for folks in that community. And it's been very successful, and we've been building bridges. Part of my mission at People's Health was when I came on board 3 years ago was asking myself, who's not walking into our clinic and why are they not walking into our clinic? And so we've begun to change our forms, how we introduce ourselves, to recognize that there are, whether it's from the LGBTQ LGBTQ+ community, or, migrant workers in our community, or just other people from different backgrounds. Why aren't they coming to us for the services that they can get? So we're making some pretty dramatic changes. And as I said, each year we're seeing more and more patients served. We saw about a 40% increase between 2022 and 2024 in terms of the patients that we served at the clinic.
Question.
Oh, yeah, do you have any information on how many people are actually using those housing kits when you give them out?
Just that we know that they come back for more, the following week. So yeah, it's definitely being used. The challenge is of course you need access to clean running water when treating your wounds. So basically, if I know my nurses tell me if you're in a public bathroom, like that's your opportunity to clean your wounds, So, and what we do at the clinic is we do have a shower. So my nurse will literally help these people shower, treat their wounds, which are covered in all over their limbs. So it is a real challenge.
Sorry if I'm squinting at you, my glasses are broken.
No. As a fellow glassware, I understand. So.
Super clear.
Yeah.
So, you referenced the federal challenges that are coming up. I know I've seen some of the executive orders that are, going to be difficult for Vermont.
Yeah.
And it would be helpful for you to keep us informed about what those challenges are for you. So like going forward, whatever, I don't know what we'll be able to do, to be honest with you, because it is challenging. There's no question about it.
I know, just yesterday I was working with my staff on our plan, what to do if ICE shows up, because I know the federal government has lifted that prohibition that ICE wouldn't show up at healthcare centers or churches or schools. So now we have the stark reality that ICE could show up and demand patient records or access to patients. So we're putting together the internal plan. And even this week, we saw migrant workers come in and refuse to sign our paperwork because they were afraid that this information could get in the wrong hands and get them in trouble.
This is a question. Do you know the answer? And maybe I'll ask my lawyer the question as well, but can ICE access patient records that are protected under HIPAA regardless of citizenship?
If they have a judicial warrant, is my understanding.
Yeah, okay.
So
Yeah.
in the process of educating myself, and my understanding is that there's an ICE warrant that they sometimes present, which would not give them access to protected spaces or protected patient information. It would allow them to come into my waiting room, for example, and question patients there, but they wouldn't be allowed back into the space, the exam room space, but if they have a judicial warrant, my understanding is, my next call will be to our attorney, to work that out. So.
And I think one of the challenges, and I'm sure this is what healthcare entities across the state are experiencing, we have this set, we know the rules that are in place now, but we don't know what we don't know could happen. And so trying to just stay on top of the changes that are, happening in real time, but then also think about, we can sort of plan for the worst case scenario, but based on the existing laws and policies, but how do we think about how to plan for instances in which that changes, and maybe the rules about what ICE can access change. And I think that's probably the most unsettling, maybe not the most unsettling, there are a lot of unsettling things, but that's a real challenge.
It is. It's very unsettling, I think, to everyone, but it's also what you're doing is so critically important for patients. This is really good. And how many? So you said we have 8 clinics across the state. Can you just give us an idea of where they are all located?
Yes. As far south on the western side as Bennington, there's a free clinic in Bennington. And then up through Rutland, Middlebury. Like I said, we used to have the health assistance program at UVM. So that was our furthest north clinic. They're no longer members. And I actually don't know if Middlebury or Barry is further north. That's the western side.
Yeah.
I think Barry's.
Yeah,
Yeah.
probably. And then coming down the eastern side, Barry, Randolph, White River Junction, Windsor. So the lower 2/3 of the state.
Right.
Yeah.
Okay. And do you see a need for additional services in other parts of the state? Or
Sure.
Yeah.
From what I hear talking with folks, especially the Department of Health district offices in the Northeast Kingdom, I was part of a meeting with, I think it was Grand Isle County and Memorial County, and they were talking about, as the district office of the Department of Health, they'd been involved in kind of some pop-up clinics that were at various different places and kind of got folks at, the food shop, a bunch of other social service organizations come together, and they were just curious about the free clinic model. They were also curious about mobile services. So from talking with them, I think there's certainly a need. The Notch is a federally qualified health center. It has I think it has a couple locations in the Northeast Kingdom. Maybe Brian?
Not aware.
No. But from talking with the Department of Health folks, transportation is the big issue.
Yeah,
and
it is.
they didn't have, at the community health center, it sounds like they didn't have the ability to kind of go out into the community. One of the great things that we've done in the last 6 months is partner with the Department of Health and a local dentist to provide pop-up oral health clinics. A series of 6. We've done a couple. We have another one in Barton in April.
I've been
Yeah.
seeing that one on
Yeah.
Facebook feed, yeah.
Good.
Yeah.
I think we're working really hard to get it.
I thought about going myself, but
No.
I'm definitely sure. So I don't want to take up resources.
No, it's
that
a
other people.
it's a great resource. And so I'm saying that because we've just seen pretty overwhelming response about the need, particularly for oral health services in that area. So there's Barton. I think there's going to be another in not St. Johnsbury, St. Albans. So trying to meet the need.
I just wanted to say, it's a comment, not a question, but I know in Burlington, we are really looking forward to having our overdose prevention center enter the scene to really take some pressure off of our emergency room and our paramedics and our firefighters and our police, and to provide health care to folks who are in need of it. So we're just really waiting patiently, but hopefully that will be another part of the puzzle here in Vermont. But it's an important entity, a healthcare entity that we desperately need.
Well, and it highlights just the I don't want to say the burden, but I can't think of a better word, but the burden on emergency services when there's a gap. And so when we talk about kind of our averted emergency room and hospitalization charges, that's what we're sort of talking about, that there's a gap that we fill that if it weren't for us, based on estimates, based on publicly available data, we can assume that a portion of our patients would use the emergency room for lack of another place to go. So it sounds like a similar.
Yeah, or emergency services to get them there.
Yes.
Yeah, no,
Right.
it's really, yeah.
Yeah.
This is great. Any other questions? I will share with you that when I was in college and graduate school, I began a clinic, a migrant care clinic.
Really?
And today it's expanded. It's huge and it covers a significant part of New York State. No, what you're saying resonates, but it's come to a whole new level. It's great.
That's fantastic, Senator. Wow.
Yeah, well, other things with it, but that was part of it.
Wow, I wasn't aware of that. That's great.
Yeah.
Yeah.
No, well, this is the only time I share it. So.
Budgets for you guys.
Yeah.
What do you need for budget?
So our annual budget's about $440,000. And for us, about 45% of our budget is the legislative appropriation.
Okay.
And the rest is just fundraising for the community. So, yeah.
And you, man?
So I can speak to my own budget, which is about 100,000. And that pays for, it's the association, office budget. And so that's, my salary, but it's also a whole host of projects and programs that the association pays for that the clinics have access to, like the shared patient database. So that's included, that's my budget. And then what I oversee is the full legislative appropriation, which pays for the office budget, and then it pays for chunks of member clinics
And it's like
budgets.
1.4.
It's 1.5, 84252, I think. I should have written it down. That's not.
I mean, I think that's something that this committee would really, take into.
Right, well,
Especially
when
for,
we,
I mean, for what you guys are doing, I applaud you guys. for what you're
it's
doing.
not much, is it?
Yeah,
Yeah.
no, it's not. When we think about the rest of the system, and I would say too, the number that I quoted, it's 53% of our sort of collective operating expenses. Dan, it covers about 45% of his budget, and I will say the size of the clinics vary a lot. So the portion of the legislative appropriation that goes to one clinic, it could cover 75% of their expenses. At another clinic, it could be as low as 20%. And so the burden of fundraising and making up the difference, as it were, from what the legislative appropriation pays from what their total expenses are, is unevenly distributed. That's something that we think about a lot. So I don't want to make it sound like everybody's great. Everybody's got 50% covered. There are clinics who are seeing more patients, and have higher expenses. For which it covers less of that. So
You mentioned Randolph, of course, that's in my district.
yes,
Which doctor's office?
it's Health Connections. It's through Gifford.
Through
It's one of our referrals. So one of the things, we didn't have a ton of time, so I didn't get into the nitty gritty of why it's free and referral. So it's a program through Gifford. It's called Health Connections with Gifford, and they do basically all of Gifford's insurance navigation. They do Medicare enrollment support, help with hospital financial assistance. Their director just retired. Michelle Packard was there for 36 years.
Yeah, they was the director.
Yeah. So that's all I was there.
Thank you.
Thank you.
One more question.
Thank you, Madam Chair. What are you filed as, tax wise?
501(c)(3).
Yeah, I thought that'd probably be it. Do you ever get like donated medical supplies from medical supply companies?
Yes.
They should be able to write that stuff off as a charitable donation.
Yeah, we would not be able to do our work without these donations, both from medical supply companies, pharmaceutical companies. Central Vermont Medical Center is, probably outside of our legislative funding is our biggest, financial supporter, and is always keeping an eye on all the equipment that they can donate to us. We've gotten EKG machines, blood pressure cuffs, we have a fantastic relationship with them. So we would not be as healthy as we can be without a kind of a healthy local hospital too.
Do you donate, do you receive donations and then give out donations of like clothing and things like that to patients that come in?
Absolutely. We actually launched a clothing shelf last year in our conference room upstairs. So at the same time, Vermont Cares is doing their needle exchange and we're doing the xylazine wounds. We have hats, blankets, shirts, everything we can get. This week, we've probably just gotten bags of blankets, which we're going to bring over to Good Samaritan Haven because we know there's a lot of people out in the cold, especially this week. So
And then I saw one this morning on Berry Main Street with a blanket wrapped around him.
that probably could have been one of the blankets that we gave out
It was
yesterday.
a small blanket.
Yeah,
He was walking with it.
yeah.
It's good to know because sometimes it's hard to find where to take stuff that you want to donate.
Yes.
It's good to know.
Yes, I mean, I would say, unused pharmaceuticals, medical equipment that's still in good shape, anything from crutches to, your blood pressure cuffs, we'll take it. So, yeah.
And that's true. That I would say that's true for all of our members. And Dan's talked briefly about clothing. Food is another really big service. Some clinics have sort of official food shelves. Others have an informal. Somebody cooks a hot meal every time they have an evening clinic. Everyone who comes in is welcome to take a meal.
That's awesome.
Yeah,
Yeah.
it's a real, and so that's what we talk when we're talking about sort of the product. Yeah.
And it just-
Someday we'll share stories. This is great.
Thank you so much. I really appreciate the time.
Well, no, thank you. We're at a time where we really need you in a significant way, so we'll probably hear back.
We're happy to come back. Thank you all.
We got you out of the flood zone.
Yeah.
Yeah, time to move.
You know, Urban Berry, we love to show off our new building, come by. It really brings dignity to the people we serve. So,
Right
yeah.
right on the green.
It's, yeah, right behind City Hall Park. So with, and we have good neighbors, all the churches there.
So,
Yes. That'd be great. I would love that. Yeah.
yeah, well, I'll have Kiki see what we can do.
Okay, fantastic.
I would love to see
Warming
it.
shelter.
Please, that'd be great. Yeah.
But I get you extra, they can come to you.
Yeah.
Absolutely.
Why not?
Thank you all.
All right, thank you.
We'll go separately individually.
I know. The doctor that was on the Mount Care board. What?
He was
Who?
working in Barry. I can't remember his
Oh,
name.
right, Doctor, I can see him.
Yeah.
I don't want to name what's going on next year.
Day.
Oh.
But
Great guy, I worked with him on the AHEC board for a while.
he did, I was there for a long time and then got Celia Starr, he was the director.
Oh, yeah.
No.
We still on.
We are going to move
Yes,
on
that's where she's
to
going.
our next. We're caught up with our time, which is amazing. We had a lot of, had an open schedule this morning. So we're going to move on to, hear from the Vermont State College system, mostly about sort of the healthcare workforce and some of the programs that are there at VSC. And really look forward to hearing about it. So how are you organized?
I think I will just be speaking and then I have brought a couple other folks in case you have more questions for me.
Perfect. All right. So what we're going to do is we're going to introduce ourselves so you
Okay.
know with whom you're speaking, and then we'll have you introduce yourself. Go ahead.
Senator Larry Hart from Orange County.
Say about this components.
Jenny Lyons, Senator from in Southeast.
Martine LaRock Bueller, who just ate a peanut butter cup, Chittenden Central.
It's from Washington. Thank you for being here.
Thank
So you introduce yourself for the record and then share with us what you have. And we may interrupt.
Sure.
We'll try to let you get through everything. And we'll have a hard stop a little after 20 after, say about 20 minutes ago.
Excellent. Well, thank you. Thank you for having us here today. I am, for the record, Beth Mount. I'm the Chancellor of the Vermont State Colleges System. I've lived in Addison County and have been honored to be the Chancellor of the Vermont State Colleges System now for just a little over a year. With me today are Sharon Scott, who is the Chief Financial and Operating Officer at Vermont State Colleges. And on Zoom is Caitlin Stover. She is the Dean of Nursing and Allied Health Programs at Vermont State University. So I always like to start out by thanking you, Sharon Lyons, for allowing us to speak and really talking about what our history is. Why are we here? So the Vermont State Colleges System was founded by the legislature for the benefit of Vermont. We believe that every Vermonter, regardless of their income or their location, should have access to high quality higher education. We are constantly developing our workforce opportunities for our students so that we can help to grow Vermont State's economy. And we are preparing learners at all ages of their lives so that they can take advantage of the opportunities of today. So today, what I'm going to talk about is the workforce that we've done specifically in the healthcare field. Before I get too much into that, I just want to talk about what the Vermont State Colleges is. So the Vermont State Colleges system is comprised of the Community College of Vermont, which has 12 centers that are throughout the state, and Vermont State University, which is the 5 legacy institutions. Over the last couple of years, the legislature has really worked to help the Vermont State Colleges system in its quest to have high quality higher education for every Vermonter. And we want to thank you for all of that. And we appreciate the investment that the legislature has made in us. It's clear that the legislature's investment in us is working. One example of that is that in this last year, there was a 14% increase in the new student enrollment at Vermont State University, and we're projecting another double-digit increase this year. So the investment you have made really paying off.
Amazing. Yeah, that's terrific.
Yeah, we're excited about it.
Yeah, terrific.
So let me just talk about how we're driving Vermont's workforce in healthcare forward. So we have comprehensive healthcare education programs that really allow a diverse career pathways for a variety of learners, whether that be a person who's in a Bachelor of Science in Nursing program for their entire career, or that come in and out of the program in stackable credentials. The two institutions of the Community College of Vermont and Vermont State University really do work in tandem so that students are able to navigate those ladders. And really, we are looking always to align ourselves with the workforce needs of Vermont. So it's a continuous improvement loop that we're looking for, because frankly, we want to ensure access for all students at varied times and for varied groups in their life. So what should be behind me now is a list of our healthcare.
Next slide.
Yeah, is the healthcare program.
There you go.
So in this list, you will see that we do things like we train folks for direct patient care, things like nursing or dental hygiene. We have also preparation programs. A lot of those are at the Community College of Vermont that prepare students to be medical billers or coders, where they can really get their first exposure to a healthcare field. We are dedicated to rural healthcare access and preventative care, and we are really concerned about ensuring that our most vulnerable citizens have access to high quality healthcare. What I'd like to show you next is a 49-second video. It talks about an activity that an interdisciplinary team of our students was able to accomplish as a simulation one day.
Today we did a simulation with other disciplinary students, nursing, paramedicine, and radiology.
We were doing a simulation that focused on caring for a patient who was in respiratory failure, who started out being transferred from like a pre-hospital setting and then decompensated through the course of the scenario up until needing intubation and needing full ICU care. The students did amazing. It was really cool to watch kind of the progression, and the real focus of the day was to try to help the students understand each other's roles and each other's scopes of practice and how they can integrate and work together as a team.
It went well. Our patient survived.
That was my first question.
So, well, thank you. So I want to next just go into a couple of the more specific programs we have. And I have great news for you. We really are delivering results. Senators, in every one of the districts you serve, we work with the hospitals in your district to ensure that they are getting the needs that they need. We have educated 328 new nurses for Vermont. There has been a 14% increase in the graduation rates given the critical occupation scholarship that was funded by the legislature. The NCLEX pass rate in all of our programs exceeds 90%, and in some of our programs it is 100%. And the big news is most of our nurses stay right here in Vermont, and we're very excited about that. Let me shift gears a little bit and talk about our dental therapy program. In 2016, we were given an opportunity to stand up a dental therapy program. And we thought that this would solve the lack of dental professionals in the state. What we've discovered is that there are a lot of challenges to standing up a program like this, most specifically that you really need a dental school in order to be able to do this. We really need to figure out if this makes sense for us to be delivering, especially as we look at it from a cost perspective. We're evaluating that right now, and I will come back to you as we are making those decisions.
But do you think you'll have that decision during the springtime right now in the next few months, or are you looking further ahead?
Soon. I don't know that it'll happen during the
Okay.
legislative session, but soon, certainly. For us, we really have to make sure that our efforts are in things where we can have really good progress, where we can ensure that we are meeting the needs of Vermonters. We know how important dental health is to every Vermonter. And what I really want to focus on is what we're doing well, because for us, every dollar counts. Every dollar that we get from the legislature, from our tuition, from our students really does count. So let me talk a little bit then about something that is going really well is our dental hygiene program. I just have really good news about dental hygiene. It is a thriving program for us. Our graduation rates in that program are up by 50% since 2019. 75% of those graduates stay right here in Vermont. And last year, there were more than 2,500 patient encounters, things like cleanings and that, with our students and folks from around Vermont. And in particular, I'd like to thank Senator Welsh, who did give us congressionally directed spending to increase the number of students that we're able to serve in this program. And what we will be able to do is double the enrollment in these programs as we get that facility up online. So I want to just talk as we're closing here about some of the free and reduced tuition scholarship programs that the legislature has provided. Nearly $19 million has been awarded from 2021 to 2024. This has been so important. As you kept hearing me say, our completion rates went up. So when we think about programs like this, it's not just getting someone to start a program like this. It really is getting them to continue. If we have a laddered credential, it's ensuring that once they've gone out and are starting to practice, that they can come back in. And so we have been just so thankful for the legislature for having these programs, which we are seeing results not only in recruitment, but most especially in those completion rates. So we want to thank you for all of those. Now, the scholarships that you've given us have certainly been in the allied health professions. However, that also was in the early childhood education program, which we know, as you all know, that we need to have quality early childhood education workers in the state so that everyone can go to work and feel comfortable about where they're working. So those programs were also in that, and we saw increases in those programs as well. But I just want to thank you, and I can take any questions. Fun time.
Terrific, thank you. Do we have your slides?
You sure?
Can we?
Yes.
Can we get your
Yes.
slides? That would be great. We'll keep them for reference. Just a quick question. So you talked about the number of students that you've seen increase in your dental hygiene program from 25 to 48. Do you have a similar cohort in other areas, or what are the size of the nursing program? And I see Caitlin up there ready for the question. So just a little bit of information about the numbers of students that you're seeing and what the trajectory is. Is there increase?
Hi, good morning, everyone. Thank you for the question. I think that it's really important to know that the academic year 2024-25, what we're currently in, we have a total enrollment of 702 nursing students across our 5 programs. And this is up almost 50 seats from last year. We are in the phased increase across all of our sites, all of our programs. When I look back on the data that is available, we did open up more seats and not all of our seats were filled. So I think that that's a really great opportunity for VTSU to market more seats, reach out to our employers and our clinical affiliates so that students who are looking to pursue a nursing career through any of these ladders know that there are available opportunities for them. I would also like to say that thank you, Chancellor, for talking about our NCLEX pass rates and our scores. We are still waiting for Q4 data from the National Council of State Boards of Nursing. We will receive that data in the end of March, and we still have 40 students outstanding that, according to Q3 data, had not taken their exam yet. So there is a possibility of an additional 40 students that are already practicing in the nursing workforce in Vermont that we just don't have that data for yet. So I think that that's an also really important point. The trajectory is that we are consistently adding additional nurses year after year, and those are across the LPN, the associate's degree, and bachelor's and master's. We will graduate our first master's prepared nurses this summer.
Wow, that's amazing. Terrific. And we've heard in the past that you've had some challenges finding clinical placement, and how's that sugaring off, I guess, at this point?
Great question. You know, I have to say that finding the clinical placements are not as difficult as finding the clinical faculty to teach those clinicals. So I know that so it comes sort of hand in hand. So we may not be able to use a clinical or offer a clinical section because we just don't have the clinical faculty. But in my experience in the past 6 months, there are amazing clinical partners in this state that are really stepping up to provide our students a high quality clinical education opportunity. So for me, the challenge is more on the faculty side.
Well, thank you. Other questions? I know Senator Douglas had a question.
Thank you, Madam Chair. So kind of a two-parter here. Do you have any numbers or any data on how many of your students overall, but especially in your medical programs and nursing programs, that are staying in state after graduation? And then the second part of the scholarships that you offer, especially those that are funded through legislative appropriated funding, are there any post-graduation in-state residency requirements to keep people here? Because, you know, speaking from the legislature, the money that we give for those programs, want those to be going towards nurses that want to stay in Vermont, or at least stay in Vermont for a good amount of time, fulfill our nursing and medical needs.
So, you want to? Caitlin, get it?
Why don't you start first?
Okay, I'll. Yeah, so, you know, overall, you know, as I mentioned in my documents, especially in our healthcare programs, we see a tremendous number of our students staying in Vermont, 75% of the dental hygienists, and equally high numbers of our nurses. We don't always have great graduation rate where students are going overall. That is certainly a data point that we are looking to get more of. But that is certainly a focus. I do know some of the scholarship programs that we have do have a requirement that students stay in state. I mean, yeah, I should let.
So, for the record, I'm Sharon Scott, who's the Chief Financial Officer. VTech has a forgivable loan program for nurses that does have a residency requirement for them. The Vermont State Colleges does not, related to its scholarship programs, have a residency requirement attached to it, nor did the critical occupation scholarships that were offered between 21 and 2024. But we see very high numbers of our graduating students in the health professions remaining in Vermont. For nurses particularly, the average age of the nursing student for the Vermont State Colleges is between 28 and 29. So they're already embedded in their communities. So they are more than likely to be remaining within their community. And if they're out of state, for many of them, it's because they're from a bordering community and they're working at a healthcare facility that's already in one of our bordering communities. But we're very pleased with the number of students who graduate, remain in the state relative to the health professions, and then are practicing in the state, which is phenomenal.
Oh, go ahead, Caitlin.
So I can say I do have that information for the graduating class of 2023, 2024. So those who graduated last spring, we have just shy of 90% of the nurses across the programs sat for their first licensure in the state of Vermont. So we can extrapolate from that, saying that they are therefore staying in the workforce. We are in Vermont. We are a compact state, so it is possible that they may go over and work in our neighboring New England states and or New York. But initial licensure is a really great data point to look at. And then yeah, I think the chancellor spoke to the 75% dental hygiene. I can say that all of our respiratory therapy graduates stayed in Vermont, and all but one of our radiology students stayed in Vermont.
That one.
Well, this is why this is such
We
good
went
news.
to Florida.
You know, we keep hearing really sour news in this community, so this really is wonderful, and we appreciate everything you're doing for the work and for the results that are happening. We really appreciate that. And I just wanted to recognize Representative Dickinson, who is here. You want to introduce yourself and your role?
Yes, Representative Lynn Dickinson, I represent St. Albans Town. I've been a legislative trustee for the Vermont State College System for about 12 or 13 years, and I'm currently the chair of the board.
So good work.
And I want to thank our leadership.
Yeah.
We want to thank.
So it's kudos all the way around. And frankly, you know, this committee and as well as economic development did a significant amount of work on workforce, and we look for your recommendations so that we can continue our relationship, but also continue the progress that you're making. Yeah, we know we have needs out there, and we know that travelers are a huge effect in the state. So
Well, we
Yeah.
do thank you for, all of the support. Really, we couldn't have done it without you.
So one question. So the dental program that you're evaluating, can you talk a little bit about exactly what that program is? Dental hygiene, what is it? What's the name of it? Because it's not dental hygiene. So what is the program that is you're concerned about?
It's called dental therapy, and I'll let the
Yeah.
the nursing dean talk a little bit more about it.
So we have a really robust dental hygiene program. And what will happen is with a dental therapy program, we build upon that credential. Students will start out in receiving their dental hygiene education, and then they move on to dental therapy, which a lot of folks like to correlate to a nurse practitioner role. So not a medical doctor, so not a dentist, but in that nurse practitioner role that has an expanded scope of practice. So this dental professional will be able to provide restorative care and some surgical procedures, thereby providing more access to the population without having to really have the dentist take care of all of that work. So we're putting, the dental therapists are putting in a middle ground almost for oral health care.
Thank you. And so the concern that you've expressed is you need to have some relationship with a dental school in order to have this program move forward. And you're
Yes.
looking at the
The
program.
expanded scope of care does require, major investment on what we already have for our dental hygiene program, and then the clinical education that they require needs expanded resources. And so, to the chancellor's point, the accreditation regulations, what they are requiring, we really need to do a sit-down evaluation to get a bottom line onto what it will cost the university to support this program.
Thank you. Thank you for that. And thank you for sort of realizing the need to do an assessment on that program. I know we started it in this building, and it's been an ongoing discussion about efficacy. So now we're hearing from you, and we greatly appreciate it. We're going to end the testimony and for the day. We're going to adjourn our meeting, but thank you so